honest, and again, thanking them for being here. We have Miss April Bird with Women's Restoration. We have Miss Delaney Brunet with South Central Louisiana Human Services Authority. We have Lafourche Parish Sheriff Craig Weber, and then Dr. Caleb Dupre. He's with a couple of hospitals here in the local area. Lafourche Parish District Attorney Christine Russell, Louisiana State Representative Brian Fontenot, and Senator Mike Facey. Let's give them a hand, please, for being here. Now, each of them has a message or thoughts to share with you, and we will start out with Miss April.
Good evening. So again, my name is April Bird, and I am a teacher at Women's Restoration. And so for those of you who may not be familiar with Women's Restoration, it is a one-year faith-based regeneration program. And our mission is to help women who have no place to turn but want to be free from their addiction. So we want to give them an opportunity to learn how to live a productive and drug-free life. And I'm going to add that this is possible through Jesus Christ. So I happen to be living proof of this. The Lord rescued me out of a life of addiction 8 years ago. And I never waste an opportunity to let people know that it is only through Jesus Christ that I have been set completely free. Before the Lord rescued me out of a life of addiction, I was a meth addict and everything that came along with that lifestyle. Meaning I was a thief, a liar, and I had no problem abandoning my kids and my family for drugs. I was in and out of abusive relationships, and in one of those relationships, I found out I was pregnant. When I found out I was pregnant, I had every intention on giving up my destructive lifestyle in order to have a healthy baby. But instead, my drug use increased, and I maintained a daily diet of Suboxone, Xanax, meth, and anything else I could get my hands on. So when my youngest, Marielle, was born, of course she was born with multiple drugs in her system. And it didn't take very long for DCFS to come in and remove her from my custody. And at that time, I also lost custody of my oldest daughter as well. Instead of fighting to regain custody of my daughters, smoking meth turned into shooting meth, and my life spiraled more out of control than it already was. On July 4th, 2016, which is the turning point, I made the decision to check myself into a 30-day rehab. And after being there for a couple of weeks, I gained clarity, and I was hopeful that I wouldn't have to go back into my destructive lifestyle again. But that hope quickly faded as I was surrounded by the once an addict, always an addict mentality. At this rehab, we were also required to introduce ourselves by our drug of choice, meaning the very thing that held us in bondage became our identity. So once I completed 30 days, I transferred into Mary Song Restoration Center for further treatment. And it was there that I learned that instead of the once an addict, always an addict mentality, I learned that old things, meaning everything tied to my life before Christ passed away, and all things became new. Instead of my identity being wrapped up in what I was in bondage to, I learned through the Word of God that my identity is found and made complete in Christ and in Christ alone. Upon completing the one-year program at Mary Song, my family and my relationship with my oldest daughter was completely restored, and sweet Marielle was granted back into my custody. In 2023, I married my husband, who is sitting right over here, and he has also been set completely free from addiction through Jesus Christ. He recently adopted our daughter, and together we are fulfilling what the Lord has called us to do by working in addiction ministry. So as previously mentioned, I work at Women's Restoration. He works at a place of restoration, which is the men's program. And we have a table set up in the back, so if anybody has any questions, we would love to elaborate further or answer any questions you may have. Thank you.
Thank you. Now, everybody doesn't have to come up. We can also speak from over there, but I know Miss Alani, she's going to come up, so we'll have her next.
Hello. Okay, I have to move around, otherwise you're gonna just see arms flailing. Oops, see what I mean? I'm Leilani, I'm a registered nurse. I work for South Central Louisiana Human Services Authority. Many people will say, oh, you work for the mental health clinic. Yes, I do work for the mental health clinic, but I always bring resources because many people don't know that we have other services available that are not just mental health services. We help individuals with developmental disabilities, we help children, we help adults, we help those with addictive disorders, and so on and so forth. So if you think that we might be able to help you or someone you love, just let us know, just give us a call. I'm not being rude by looking at my watch, I just want to make sure I don't go over my time. All right, that means nothing. Okay, but I won't go over my time. Okay, so National Recovery Month is, I was asking someone, did we do this in September, this particular topic, because September is National Recovery Month? And I think they said, nope, didn't know that, but that worked out perfectly. So August 31st every year is what they call International Overdose Awareness Day. The top card you see right there is Sweet Sarah, which is Miss Renee's daughter. The two individuals on the bottom are individuals I know personally. Through the month of August for Overdose Awareness Day at South Central, we passed out these memorial cards in our clinics, and we said, hey, you know, if anyone knows someone that you lost someone to an overdose, why don't you just put a first name on there, and we'll try to do some type of memorial for them. And so these were the first three because I put those up. And then this is what we collected only in a month in our clinics. We only have 4 clinics. Now I do go out in community, I'm out and about all the time, so I brought some with me. In fact, those cards that are up here are actually in the back by my husband back there that's helping me, and there's actually a video that's rolling of the individual names. But we do try to acknowledge Recovery Month every month. We bring gift bags to some of the recovery centers, restoration centers. We actually visited, dropped some off for Sissy Bridge House back there yesterday, and to the Women's Restoration. And so various agencies are going to get those. Let me move on a little bit. The opioid use disorder continues to be a major public health problem in the United States. So tracking back a little bit, we saw overdose deaths increase more than 5-fold since 1999. And so if we go back to 2017, 2018, 72,000 overdose deaths, and they figure about 45,000 opioid-related deaths. Of those 72, 45 were probably opioid-related. Now, Laura Stanley and I were working together when I put this slide back together, and we knew, Laura and I, as we did our work and our research, we realized that these numbers are skewed because when the coroners are filling out the paperwork, if someone had multiple drugs in their system, it just went as polysubstance use. It did not go down as an opioid overdose. It just went down as polysubstance use or polysubstance overdose. So we didn't have the numbers. Now the coroners are doing a more thorough job of making sure we can tell if there's opioids in the system. Now I know Dr. Patrick Walker, who's the coroner for Terrebonne Parish, and I spoke with him the other day, and we asked him, how of the ones that you're seeing that are overdosing, how many of them have fentanyl in their system? He said, all of them. All of them. We're looking at 2022 right here, where we had 107,000 overdose deaths. They figured about 75,000 of those were opioid related. COVID was terrible because COVID put us all in isolation, and an individual who's trying to restore their life and rehab, they need that connection with those other individuals. That's their support network, and they were told to isolate. And that's when I think unemployment like doubled or tripled or something like that. So that's the 2 worst enemies of someone who's really trying to work a recovery program is excessive money and excessive time in their hand isolated. We saw a lot of relapses and several deaths as a result of that. Now, you can always notice the numbers go back like 2 years, and that's because if you know anything about analyzing the numbers, it takes 2 years to get a good reading on the data that's collected. So the 2023 estimate right now is going to be estimated that there's about 107,500 drug overdose deaths in the United States. So they're saying, oh, yay, that's fantastic. That's a 3% decrease. First time forever that we see a decrease instead of an increase. But this is provisional. Anytime we collect anything and we didn't give it the time that it takes to sort it through and analyze it, this will likely change. So it looks good on paper, but it doesn't mean that that's going to actually be the actual decrease, on top of which I wouldn't say that we're not seeing a decrease in the deaths, because what did we see an increase in here recently in the last year or two? Narcan is more readily available. So my police officers, myself and Dominic Ordon, where are you? Right over here. Dominic and I are counterparts. I work for Office of Behavioral Health. Dominic works for Office of Public Health. And Dominic makes sure the community, anyone who needs nasal Narcan, gets nasal Narcan. I make sure that our law enforcement officers, our first responders get the nasal Narcan that they need. According to Louisiana Department of Health, in 2018, there were 201 deaths from synthetic opioids in the state of Louisiana. 1,420 people died in Louisiana. 1,200 of those were a direct result of synthetic opioids such as fentanyl. So fentanyl remains the deadliest drug threat facing the United States. So the reason this happens, just to give you a little bit of an understanding of why this happens, is because all of us in here have receptors in our brain that receives opioids. Because, you've heard someone say, oh, I love to go for a jog. I don't do that, but people that do that say, I like to go for a jog because it sets off my endorphins and I feel so much better. Well, you have natural opioids, endorphins, that land on those receptor sites. And that's how God created us, and that's how it's supposed to be. And you feel better. Or if someone tells a joke, you feel better because it's filling those receptor sites. These substances land in those same receptor sites, but to a very heightened level. And so what happens is when too much dopamine is released, we like when dopamine is released, but we don't want too much dopamine released because then it acts like a sedative. We also have noradrenaline, which makes us be awake and alert. And so if someone is using opioids, especially if they're taking too much, the dopamine goes up and the noradrenaline goes down. And that teeter-totter effect like that is everything that's going to cause this person to fall asleep, stop breathing, eventually go into cardiac arrest. This is when we have to hopefully find them early on and administer nasal Narcan to bring them back. It also minimizes the perception of pain. Again, the perception of pain. If you've broken a bone, you should be in pain. You're abnormal if you're not in pain. But this tells your brain, the bone's sticking out, but it doesn't hurt. So that's a perception, but it's not a reality. Therapeutic doses, if you're taking it, you just had surgery or you have wisdom teeth pulled or whatever the situation is and you're taking it, it might give you some drowsiness and slow digestion. That's a normal side effect. If you take higher doses, it can cause loss of consciousness or even death. Now, I'll always give a definition of this, always, because I'm going to refer back to this in a minute. But synergism is, there's certain risk factors that we look at for both prescription fentanyl and illicit fentanyl. Now, there's a medication, a therapeutic pharmaceutical medication of fentanyl. That's not anything new. The hospitals use it, they've always used it, cancer patients get it. When we're talking about fentanyl, we're not talking about that. So fentanyl, pharmaceutical fentanyl, they still use patches and whatnot. They use it sometimes when they do angiograms to help a person to relax, and it's quick acting. They can get the person off really, really fast. What we're talking about, when we're talking about the fentanyl that we're talking about tonight, that's the one that's manufactured primarily in China. And so it's a lab, if you will, but it's not like a pharmaceutical lab where you would get the other ones. Now, whether it be a prescription drug or whether it be an illegal drug or an illicit drug, we have to follow the rules. And the rules are you do not want to mix these things with each other. So if we know someone's battling an addiction to heroin, the last thing they need to be doing is taking like benzodiazepines or sedatives like Klonopin or Xanax or things like that, because individuals may think, well, oh, I got 1 milligram of Xanax and I got 1 milligram of an opioid equals 2 milligrams of this compound, and that does not work that way. So in a situation like that, 1 + 1 could equal 25 milligrams, and a person may not wake up, because it's a synergistic. So if I have a match and I have a match lit, and then I put the match near the gas burner, that is synergism. Those two connected, and now I have synergism, and that's what happens, and that's why I tell people all the time, that little yellow sticker on the side of your bottle when you get your medication that says do not use other drugs or alcohol, that's not a suggestion, like that's a directive. And so we do have individuals that pass away because they're mixing alcohol or other medications and having that synergistic effect. You're gonna hear me talk about this in a little bit. All right, illicitly manufactured fentanyl, this is the illegal one. It's sold and distributed for unsanctioned purposes. A lot of people ask me all the time, why would they want to create something that's going to kill their customers? We can't talk up to that because one thing we can't not talk to is their motivation. Could it be greed? Because it's considered a potentiator. Now, when you're trying to get heroin in, or you're trying to get other types of drugs in, and Elliot's here, he probably can talk way more to that than I can, but I won't put you on the spot, Elliot. I would not do that to you. But if I did, he would tell you the same thing. They can make this stuff so potent that it can cross the border in an envelope. So it goes undetected. It goes undetected. And I don't know, I can't speak to it for now, but for the longest time they were saying the dogs couldn't even detect it. So they could mail it through the mail in an envelope, the same amount as if it was coming in cases. So is it greed? Could be greed, but I can tell you what it is a potentiator. So if whatever you have an abundance of, a fluff of, you add a little bit of that to it, and you just increase the potency of whatever it is, whether it be methamphetamine, whether it be cocaine, whether it be marijuana, anything is going to increase that. It can be synthesized into more concentrated lethal analogs. One of them is aquafentanyl. Aquafentanyl is a fentanyl, and I will tell you what I learned at a training I went to one time. There was a gentleman that did a training for us down in Cutoff, actually. I got invited to go to this. This guy was undercover for 3 months living with the cartel. And he told us that, they put an end to that operation, but he said that what he learned was not all fentanyl was created equal. So you can make a standard batch that looks identical. So you have 5 of the identical batches of fentanyl, and then they'll start adding, and I'm talking about China, they'll start adding something to this one, something to this one, something to this one, and then they'll put it out there to see which one was stronger by watching the news to see where, they tell them specifically where to send it to. And so could it be warfare? We can speculate, but we can't say definitively all the different reasons why it's that way. But the things like aquafentanyl, which creates a problem for us, is it makes it so sedating that they're coming back with an Narcan. They're going to come back. It's just 2 things happen. Number 1, makes it a little more stubborn to bring them back. We might have to use 2 more doses than we had to before, or we have to load them up with it because it's quick. But the half-life is also quick, so the Narcan wears off fast, and the person goes under again, even if they didn't take anything else. It's so strong, it's in their system. A lot of the fentanyl deposits in the fat tissue. So once the Narcan wears off, it's like they're a fentanyl depot. The body starts pulling from it again. It's concerning. It poses a serious threat to unsuspecting buyers. It's cut unevenly, like they whip it. Yes, okay. They whip it like in a blender. Now, there is some good news. We used to say, because we're based on CDC and FDA, that if you touched it, you could risk an overdose. We know now that that's not true. The molecular structure is too big for it to be absorbed into the skin, but people see it, panic, do this, and it gets airborne, they inhale it. That's probably how it's happening. We at South Central have different treatments. Dr. Hyatt, could you stand up for a second? This is Dr. Hyatt. He's our addictionologist, doing an amazing job with our clients. We can answer questions about this later, but we have treatment. He's our addictionologist. These are the different things we have, different medications we have. We'll talk about that in a minute when we talk to the panel. And we've been serving our community since 2018, giving our law enforcement officers Narcan, our firefighters get Narcan, pretty much anybody who needs it. I take care of the communities. Dominic takes care of the community at large, make sure we're covering all of our bases. This is just a quick thing on the revised statute to say that you can possess it and you can administer it without fear of being sued. And you can be sued for anything, but you should be cleared from civil liability from saving the life of this person as long as you're not grossly negligent in doing so. And this is just a quick start guide. We'll talk about this later with the panel of how to use Narcan. These are the things to look for if someone could be in an overdose. Unusually sleepy, slow breathing, slow heart rate, their skin feels cold and clammy, pinpoint pupils, nails are blue. This is the Narcan we distribute. Actually, they actually put this over the counter now, so you can get this at the pharmacy over the counter. This is one dose, one plunge is one dose, and we'll talk about that later. And basically, you're gonna give it to an individual, wait 2 minutes, 30 seconds, see if they come back. If not, you're gonna administer it into the other nostril, and you can do that every 2.5 minutes until EMS arrives. If they wake up or they start breathing, recovery position. So that's all I have for you right now. There might be some other questions when we start talking to the panel, so just feel free to ask those then. Like he said earlier, jot them down on a card and we can get those answered for y'all. Okay, thank you.
Thank you very much. And again, thanks for reminding people, you do have those cards, so if you have questions, please feel free to fill them out, wave them in the air, and Vicki or Sherry will grab that. Next, we have Sheriff Craig Weber, maybe kind of give us an idea from the law perspective what's going on.
Well, good evening, and thank you for the opportunity to join you tonight and discuss this really critical issue. I want to start with a few statistics. I don't want to get too deep into the statistics, but I think it's important. I'm very proud of the proactive stance that not only the Sheriff's Office, but the District Attorney and our court system have done in Lafourche Parish. In 2022 is the last year that the State Department of Health has published statistics on overdose deaths by parish. I guess they'll be publishing 2023 sometime this year. And those statistics are very inaccurate because some people don't report at all. But in 2022, Lafourche had 30 overdose deaths. In a recent article, there was an appearance before the Terrebonne Parish Council. Terrebonne didn't report in 2022 of that year, but they were reported as having 68 deaths. At 30 deaths, that's 0.03% per 100,000, or 30 per 100,000 is 0.03%. The state average has been 52 deaths per 100,000. So Lafourche is substantially lower than the state average, and I'm very proud of that fact, and I believe there's some reasons for that. Now for 2023, last year, we have our own statistics because we're very focused on the results of what we do in our, I'll talk about COPE program a little later. Last year there were 32 deaths, which almost consistent with the prior year. Out of those 32 deaths, there were 228 overdose events. So when Leilani talks about the value of Narcan and intervention, if you compare those many overdose events to only 32 deaths, that's remarkable. Of those, 157 were male, 71 were female, 169 were white, 57 black, 3 Hispanic, 1 Asian. Also last year, our office did 143 Narcan doses, administrations. That's small in comparison to the fact that EMS does Narcan, fire department does Narcan, local police department uses Narcan, and Narcan is commercially available, and many people who have addictions keep it on hand, and rightfully so. We only have 6 months of statistics in 2024, and yesterday morning, I was driving, listening to the radio, NPR, and I was thinking about this presentation and the statistics related to overdose deaths. And there's a story, I would suggest you might go listen to this story or read it, where there are some incredibly encouraging numbers for 2024, where the death rate has gone down, and it's really inexplicable. In some cases, it's gone down by as much as a third. And so what I did was I took the 6-month averages, the 6-month numbers for 2024, and compared them to a 6-month period in 2023. So far, the first 6 months of this year, we've had 77 overdose events. Last year, there was 228 divided by 2, 114. That's a 32.46% reduction in the first 6 months of overdose events. In the first 6 months of 24, we've had 10 overdose deaths. Last year, there were 32 divided by 2, that's 16. That's a 37.5% reduction so far. And again, I agree with you, you don't want to jump up and claim success because you have to look at these things over time. But any reduction is a positive thing. Anytime you prevent a death, however you prevent the death, you give that person an opportunity for a life. And we've only administered Narcan 43 times in the first 6 months of 2024, as opposed to 71.5 times for 6 months in 2023. So that's a 39, almost 40% reduction. So there are a lot of positive things going on in terms of statistics. Now let's talk about different statistics. Let's talk about how we as a sheriff's office and as a parish approach it. We approach addiction, overdose deaths, drugs, and mental health from a prevention, intervention, enforcement, and treatment perspective. Prevention, and in the prevention arena, 30 years ago, drug abuse resistance education was the end-all be-all. And then over time, it fell out of vogue, and many sheriff's offices and police departments no longer teach there in schools. You'll always have a challenge with any kind of prevention, whatever you're trying to prevent, because prevention, you never know how many people really succeeded. You can only count failures. You can't count successes. So if you're doing prevention and someone doesn't die, or they don't start taking drugs, or they don't engage in negative behavior, the only way you can benchmark it is by looking at failure. So we still believe that DARE is important. We still believe that having a police officer connecting to a child in elementary school and providing that guidance and that association is a positive thing. And we believe that there are children who benefit and otherwise might get caught up in a life of addiction, or get caught up with parents that live in addiction and live in dysfunctional homes. And you know the old saying, perfection is the enemy of good? Well, just because we don't have perfection in prevention, doesn't mean we don't have good in prevention. We also are very proud of, and I'll speak to a greater degree about our comprehensive opioid prevention effort, or COPE as we call it, which was a $2 million federal grant for 3 years. And I'll tell you about the people here that work in COPE, can tell you about the great work that they do and some of the things that we've been able to succeed with. We use our social media very effectively to discourage people and to report people who are using drugs so that we can intervene. We have an officer assigned to the Children's Museum on a full-time basis, and they have a display called Safetyville. And schools send kids to that museum, and that officer works with those children and talks about dangers and prevention and poisons and things like drugs. In every office, we have the prescription pill drop boxes. So once you finish taking your drugs for whatever ailment that it was prescribed for, just don't leave those extra pills hanging around for an addict to find them in your medicine cabinet. Come bring them in a safe place where they can be destroyed. That's a little thing. It's not one thing in and of itself, but it's all these little things together that add up. We operate a misdemeanor probation division within the sheriff's office. Those individuals supervise addicts who are out in the community. They drug test addicts who are out in the community to make sure that they're staying straight. They also put electronic monitoring and house arrest bracelets on people who sometimes have addiction and monitor them as well. We've had actually people get high while they're at home on a bracelet, and they see that the person is not where they belong, have a deputy go, and sure enough, that person needs to get into a hospital. Enforcement. We're very proactive with aggressive targeted enforcement and general enforcement. Now, what's targeted enforcement? I'm going to divide it into two areas. A drug task force is a group of specialists whose focus is proactively seeking out drug investigations. We want them focusing their time on distributors. Now, they'll arrest addicts, no doubt about it, because some distributors are people who are addicts and they distribute to support their own habit. But they are doing more long-term targeted investigations. They're getting search warrants, they're doing wiretaps, they're doing surveillances, they're using other investigative techniques to make arrests. In addition to our local drug task force, we have 2 deputies that work with DEA in New Orleans. That's a force multiplier, and it brings to bear all the federal resources of the Drug Enforcement Administration and the U.S. Attorney's Office for federal prosecutions. When we got a mid-level or high-level dealer that's identified, one of our agents working in a task force group can use those other agents and again, the resources of the federal government to do those investigations. The Drug Task Force in 2023 made 210 arrests for the year. Thus far in 2024, they made 111 arrests. Now again, those are proactive investigative arrests. Our patrol deputies, our school resource officers, our K-9 officers, our correctional officers, all of the other members of the sheriff's office are also encountering people who have drug addictions or have drug offenses. In 2023, they made collectively 314 arrests for a total of 524, and thus far in 2024, they've made 238 arrests for a total of 349. So those arrests and that aggressive enforcement is important, but I will tell you that we will never arrest our way out of addiction. If anyone has any belief that that's the case, go back to the 50s and the 60s and the 70s and the 80s and the 90s and the war on drugs and the czars. We have to continue to keep the pressure on people who produce, who manufacture, who distribute. Those are the people who really need to be behind bars for a long period of time. And we also have to put addicts in jail from time to time, because sometimes that arrest is an inflection point. It's where that person says, whether it's the birth of a child or a pregnancy or an arrest or something along those lines, there are periods in a person's life when they become sober that might be the inflection point for them. So it's important that we continue to do that. One of the challenges, and Representative Fontenot and I tried to address this a couple of years ago, is that people who overdose are immune from arrest and prosecution. And the public policy on that is, look, we want people to live. We want people to have EMS and law enforcement respond. If you go there and show up and find them and they're unconscious or semi-conscious, you know they have drugs. If you arrest them, next time they're not going to call, they're going to die. And we agree. That is a sound public policy. We want life over arrest. However, our thought process is, look, there are some people that get revived multiple times. In the pandemic, we had a man living in a tent, many people, but a man living in a tent who we revived 5 times in 1 week. And so the premise of what we had talked about was, if we can document 3 or more revivals within a short period of time, we should be able to consider charging them with the caveat that they would have to be offered drug treatment court. But that ran head up against a lot of people who said, no way, ain't gonna happen. We tried our best. Maybe it's something to consider in the future, but we didn't get very far. I would encourage you, if you really want to get a true, deep understanding of opioid epidemic, read a book called Dope Sick. And the phrase dope sick refers to what happens when withdrawals, when an addict starts going through withdrawals. It is such a horrific event that they get addicted to the drug, not because it makes them high, but because it stops the pain that they're going through as they're withdrawing. And it traces this all the way back from the inception, when Purdue Pharmacy and the Sackler family put opioids on the street and incentivized drug salespeople and doctors and medical professionals to prescribe and prescribe and prescribe, and how the addiction started in Appalachia and ran all the way through into the white-collar regions of private schools and affluent people. So I will tell you that the enforcement piece is an essential part of the component, but it's not the end-all be-all. But it does have an important place, and we understand that. We try to balance that out. Comprehensive opioid prevention effort, COPE. I see Alicia and Wendy and Carla and others there. That is a 3-year grant. So far, they have been involved in 73 community events, coalition meetings, and trainings. They've handed over 5,000 pieces of literature. We do a field visit. Wendy, who is sitting back there, when we have an addiction overdose, we contact that person, we contact their family, we meet with them after. We try to use that as an inflection point to encourage them to seek treatment and COPE also has funding to help with the treatment, and we're affiliated with treatment professionals like Lilly and Start Corporation and others. We've identified 131 people in need of treatment, and I know that Wendy has personally transported in her vehicle 16 people to treatment facilities. And she's so committed that just recently she was doing a call on an individual who had been revived and was viciously attacked by a pit bull dog named Killer, who had attacked 3 other people and put her in the hospital, and she's still recovering from those injuries. I talked about the Narcan. That is essential. From the moment the state, and when our governor was the lieutenant, when it was the attorney general, he was one of the people, one of the attorney generals that went into a settlement with Purdue Pharmacy and took the money and purchased Narcan, provided it to law enforcement, and our officers have been equipped and have been using it effectively. The Lafourche Parish Correctional Complex is another area of inflection. Our reentry team, and they're all represented here, do a phenomenal job with substance abuse identification, substance abuse classes, referrals, medically assisted treatment. And you talked about some of the medications. We have been doing medically assisted treatment with naxtroxolone orally and Vivitrol injectively. And a very important part about incarceration is, for many, it's a great opportunity. I say great, that's the wrong word. A bad opportunity for someone to die from an overdose after they get out of jail because they've been forced to be sober. They can't get drugs in jail. They've been in 6 months, a year, whatever period of time. They get out, if they're an untreated addict or a treated addict and they want drugs, they go back to the dosage they were taking when they got arrested. And their body is no longer capable of handling that high of a dosage, so boom, you find people die when they get released from jail and go right into taking the drugs they were taking before. When they're out of prison, we have a day reporting center that follows through with the concept of drug treatment and drug testing for people that are on probation. We also have a transitional work program to get into transitioning people out of incarceration into the free world with a job and with income. They're drug tested, and they also get treatment programs while they're in the transitional work program. We used that settlement money that we just recently received from drug settlements to purchase MAT, to make sure that it's available. The Parish Council also received money, and they're paying Dr. Nicole Bourgeois, who is a licensed counselor, to provide free counseling to people that can't afford it, up to 8 sessions. We make referrals to her on a daily basis. We make referrals and work with the Start Corporation, and we work with people and families for civil commitments, for family members that are addicted and acting out, and we can at least get them in a safe place for maybe 72 hours. I can't say enough about drug treatment court, and I don't want to go over my time. I am a strong advocate. It is the best benefit for the buck. I think the average cost of treating someone through drug treatment court is like $6,000 a year. Contrast that to $30,000 a year for incarceration. And they are under the authority of the court system. It's forced treatment. And it's free. It's free for the individual. I know the district attorney wants to talk about it, so I'll go ahead and let her talk about that. And she's done a great job and a great partner with her office in terms of trying to treat this from a different perspective. The last thing I will ask you to do, other than read the book Dope Sick, is to attend a drug court graduation. Stories like we just heard earlier, you will hear those men and women who are graduating tell stories that will just rip your heartstrings and make you appreciate that there is sobriety. And I appreciate too, with my final comment, we started with a prayer, and this is a very faith-based organization. And I always say that I'm not preaching anyone, I probably don't know the Bible as well as I should, and as well as you do, but it's my belief that the very last soul that Jesus saved before he went to heaven was that of a condemned person who was sentenced to die. And so if Jesus can take care of people like that, I think we can as well.
Very good. And now we have Dr. Caleb Dupre going to share from a medical perspective for us.
Hello Hello, everybody. My name is Caleb Dupre. I'm a hospitalist over at Terrebonne General, and I also work at a AMG specialty hospital. So I get to see patients admitted from the emergency room who stay in the hospital. And then over at AMG, I get to follow them along if they transfer over to a more long-term acute setting. I did my training in Shreveport. I did both internal medicine and pediatrics. So I've seen a broad spectrum of folks affected by addiction, include from birth to elderly. At any given time in the hospital, I would say about 10% of my census folks have some diagnosis associated with their addiction. We see a lot of overdoses through the ER who get Narcan. I can speak more about that in just a second too. But mostly what I see is the repercussions of addiction as far as infections go, as far as changes to folks' physiology goes as well. So we deal with a lot of infections of folks' hearts, infections that get in their bones from IV drug abuse. Heart failure is a big one too on folks who use IV drugs, and it affects the valves of your heart. Oftentimes it's very challenging to treat these patients because they don't want to be in the hospital. And so oftentimes for the sake of the next fix, they'll leave against medical advice before we can finish our therapy. Oftentimes treatment for their problems require 6 weeks, sometimes 12 weeks of IV antibiotics. And that's something that's often hard to convince someone that they need to stay inpatient for that long, because we certainly can't discharge someone who's an IV drug abuser with an IV in their arm that's a direct line to their heart, who's in that position. So there's some ethical responsibilities that we have to try to keep these folks inpatient and treated, and that's where places like AMG come in handy, because it's a long-term acute care facility where we can give them their antibiotics long-term in a hospital setting that's supervised. Let's see. So the treatments that we often have to give, one is, often antibiotics or medications for their heart failure. And we're talking about young people, a lot of times I see folks in their 30s who are my age who are just destroying their bodies. The ER now has a program partnered with, I think, the state for giving folks Narcan too. So if they come in and they overdose and all they need is Narcan at the time, they observe them for a while and discharge them, and they send them out with a couple doses that might save them or their friends' lives later. So that's one of the good treatment programs we have. Recently, I know everybody's seen the billboards for Suboxone therapy too. While I don't know if those are such good programs to have, because I think that the treatment needs to be dual diagnosed programs. They need to have both the psychology of addiction and the medication side. And so while those programs might come in handy to help with the side effects of medical withdrawals, they often need more help than that. And so in the hospital setting, my hands are often tied from a treatment perspective, because I can't force someone to seek out treatment, and I can't force them to go into rehab either. So, what we have is we have packets to give them. So I brought one of those packets here today that's just lists of folks they can call, list of places they can go to seek help. And so oftentimes I just plead with folks to please, when you're better from the hospital, seek out the help that you need. I've even set up a lady who was about to give birth with a place that she can go to get treatment for her and her baby, But as far as referrals go, like I said, I can't force someone to go, but we try to help them and get them referred into a place where they can help their specific needs. And oftentimes, with medicine, I can at least try to bridge the gap with things like Suboxone in the meantime, so they can get the help that they need. The hospital doesn't per se have partnerships, but I know our case managers are involved in some of the organizations in town. So the Stark Corporation and then the South Central Human, I don't know the last word. South Central helps out a lot too, and so those are places we can try to get folks plugged into to help. And I mean, if, you know, the equivalent to a 747 passenger plane dies every day, if that was crashing into that field every single day, there'd be a lot of outrage. And folks that want to know why and get involved and do things about it. And so that's what's happening right now. We're just losing folks left and right. I think we just need more education on it from both a provider standpoint and a community standpoint. So one thing that I would like to see in the future is maybe a place, because right now if someone comes in and they don't have a medical need, if they don't need me to admit them in the hospital and they're just seeking out resources, we have to send them out of the hospital and trust that they'll go and seek out these community resources. But it would be nice if at some point we had a facility that's built into the hospital setting to say, you come through the ER, you don't have a true medical need, but maybe you just want to get clean, and just funnel those folks into a hospital setting where a provider is there still taking care of them if they need it, helping them withdraw. So.
I want to remind you about the little white cards again. So far, I've only gotten one, so you know, you guys got to do your job out there. Next, we have with us again, appreciate it so much, Lafourche Parish District Attorney Christine Russell.
I'm sorry, I'm an attorney. I cannot sit down and speak. It's the court presence in me, so I apologize. Thank you for allowing me to come again and talk about this topic. I am very passionate when I speak about it and the things that our office is doing, the men and women in our office is doing in our partnerships with all the other agencies. So I'm always very proud to stand in front of people and talk about it. When I first went to the office in 2003, we didn't have a lot of tools when we talked about addiction, drug use, distribution. We had incarceration. And so that's all we were given when we were trying to deal with these issues in our community. We didn't have conversations about mental health. We didn't have conversations about other programs. But now in 2024, we've come so far. And thank goodness we've had, because of all the issues that we have. But I want to just tell you a few things about some programs. The first program that I'm very proud of is the pretrial intervention program in our office. Almost every district attorney's office has a pretrial diversion program. It's for first-time offenders. Whether you're talking about a speeding ticket or any other non-violent offense, it's a program through our office to allow a person who maybe made a mistake and will not reoffend if we can give them services. The great thing about the program is it's different than court. If you go to court in a first offense possession of cocaine, you're going to get the same conditions as everybody else who has a first possession of cocaine. If you don't treat the underlying issue and we don't treat the behavior, then they're gonna reoffend. So this is what the program does, and I'm going to give you an example of it using something else. We're going to use a DWI. So if we have two women, we're going to pick on the ladies, two ladies who go out to La Casa and they had a really bad week and they drank a lot and they both get DWIs on the way home. Same, they blew .15, they look identical, the facts are identical. If they go to court on a DWI first offense, they're going to get a fine. They're going to get unsupervised probation, they're going to get community service work, maybe alcohol information school, maybe a MAD program. So, we treat everybody the same. Here's the difference if you go through a pretrial diversion program and what we have done. In our diversion program, we have a licensed clinical social worker that we hired. As soon as I was elected district attorney, we brought her on board. And what she will do is she will speak to those women before we set the conditions. So guess what? One woman is a school teacher, and you know how on Fridays after the end of the year, they like to go and have a drink or two. That was the only time she's ever done it. She's never going to do it again. She's so embarrassed. So her conditions may look very vanilla. The other individual that we spoke with, that woman says, I've been drinking for years. My husband left me, I'm depressed. I drink at home, and I finally got caught. Well, her conditions need to look different if our goal is for them not to reoffend. And so if we treat the person, not the charge, then maybe, just maybe, they won't reoffend. And so that's the beautiful thing about the pretrial diversion program. And since we've added that mental health component, it's amazing how successful we are in the individuals who do not reoffend. We also have drug court, and again, we have lots of partnerships with our drug court program. We're the gatekeepers, so the first thing is we get the referrals for drug court, and then we kind of look at it and see whether or not we think it'd be a good candidate. We then send it to drug court staff. They do their thing, they have their counselor, and they really get into what the issue is, and then they truly determine whether or not they can help them in that program. And then the program starts. We have an assistant district attorney who is assigned to that program, Ms. Alyssa LaBeouf. They work with Judge Abel, and these cases are staffed. They have a 45% success rate, which is fairly good. And if the sheriff is right, go to a graduation and just listen to the stories. And then come back to me and tell me drug court's not worth the effort that we're putting into it. When most of them say they started drinking at 8 and 9 years old. And it wasn't until they hit the rock bottom, and it wasn't maybe until they were incarcerated and forced maybe really to go into the program, did they finally see the light. So I'm very excited about drug court. We also have family preservation court. Not every parish has that. Our family preservation court takes women who've lost their children because of their drug addiction and works with those women to get custody back, but we'll also work on their addiction. We can take a maximum of 10 women in that program, and we have 7 right now. One just graduated, and so that is a success for us as well. And so I'm very proud of that. So those are the programs that we have. And again, it looks so much different than I did when we first came in 2003. We do have issues, and I want to kind of jump to prosecution and prosecuting these cases. And I think we need to understand what those issues are. We want to get at the bad guys. We want to get at the drug dealers. That's really who we want to get, right? And so the law enforcement uses the tools they have to get the bad guys. And oftentimes with drug dealers, the way to get them is you got to use a user. Because especially in a town like a community like Lafourche, a community like Terrebonne, your dealers know their users. So maybe back in the day, or maybe in a bigger city, you can put anybody to go in and buy, and that would be great. But now they're a little more sophisticated. You can't send in just anybody, an undercover agent, and attempt to buy. You have to have someone who's developed a relationship, and it's usually a confidential informant. There's issues with that, because who is your witness when you go to court? Your drug user. That's your number one witness. That often causes us a problem, and we have to work with law enforcement, and thank goodness we have good working relationships, to ask that agent, and we call it burning the CI. Are we prepared to give them the identity of that individual? Because then you better protect them. Because once the dealers find out who set them up, as they call it, then the life of that CI is really, at that point, needs to be protected. And I say that to tell you this. So you might have a distribution on a bad guy, and then they pick him up and they send a CI in and he buys the drugs. And then what they do is they go get a search warrant, and they go in the guy's house and they collect all the evidence. And then they charge him with possession with intent to distribute. And guess who my witness is on that one? That's the police officer, and that's that search warrant. So sometimes you might see a distribution and a possession with intent, and you say, well, why didn't that district attorney's office go for the distribution? Because if we went for the possession with intent, and we used that search warrant and that police officer, we didn't need to burn the CI, and we protected a user from having to take the stand. So sometimes we have to do that, unless the law enforcement agency says now's the time, and this is one that we need to maybe bring to trial, and maybe this is a CI that we have to burn their identity. The really big guys that are bringing the drugs in, usually the feds take them from us. So usually the big cases where we're seeing guys bringing in things maybe from California or from other places, the feds take those cases from us, so we're not seeing them locally, they'll take them. So that really is one of the issues. Another issue that we have is in South Louisiana, we have these things like COVID and hurricanes that shut down our court system. And so we had one division of court that couldn't have trials because our elevator didn't work. And the First Circuit said, if you don't have an elevator, you can't have trials, because we took a writ on that. And so we could not have trials. You might say, okay, what's the big deal? We have 5 divisions of court, 5 divisions. And each judge gives us 6 jury trials a year. That's it. We have hundreds and hundreds of cases. If we only get 6 jury trials a year and we already knocked one out because of an elevator, we're down to 5, and that means our dockets are bigger. Guess what we didn't have in Lafourche Parish this week? Court. Because our courthouses had damage. So because of that, the jury trial that was supposed to go the week of the hurricane, it was canceled. The jury trial this week was canceled. The jury trial next week is canceled. And the 3 jury trials set for October are canceled because the clerk can't issue the jury subpoenas because her office was kind of destroyed and she's having to move. So those are things that, again, put a little wrench in what we're trying to do. But that doesn't stop us, because I have to tell you, this year, here are some of our good ones. Distribution of meth, 30 years. Very proud of our prosecutors. They fight extremely hard. I have an amazing team of assistants, and they can figure out who are the bad guys, who are the people we really need to help. And when they go, they love trials, and they love to do their thing. Distribution of heroin, 22 years. Distribution of fentanyl, 25 years. Distribution of fentanyl, 15. Possession with intent to distribute meth, 10. Distribution of meth, 10. Distribution of fentanyl, 22. That's this year, and that's the dispositions they got on some of their cases. They're figuring out who the bad guys are, and they're putting them away, and they're figuring out sometimes how to do it without burning that CI, and for me, that's huge. The sheriff spoke about being proactive, and that is what we have to do. And we have many programs. The sheriff's office has many programs. Sometimes we partner in those programs. We have a personal empowerment program. It's for 13-year-old girls. I firmly believe, and I've said it every time I speak, if we can get to 13-year-old middle school girls and teach them about self-confidence, then maybe, just maybe, they won't do some of the things that they do as they're getting older, some of the bad decisions that they make. So we have a personal empowerment program that is amazing. We also talk to the boys about violence and using violence when they're making decisions. We have a vaping program. We have our wobble goggles where they put the goggles on and they can see what it's like to try to walk and you're intoxicated. We have Project Lead, which is good decision making. We're our Children's Advocacy Center of Lafourche, where our children who make allegations of physical or sexual abuse are interviewed. We partner with them to make sure that we get out in the community and meet with our children about good touch, bad touch, but also about making good decisions. Just to let you know, Lafourche Parish, since we've opened our doors in 2006 and with the partnership of law enforcement, over 3,600 children have come through the Children's Advocacy Center of Lafourche. The LCSW, our licensed clinical social worker, is crucial for us to function in our office. I do not know how we did it without mental health in our office. I don't know how we did it. When the parish came and asked me about the opioid money and said, what should we do with it? I told him my dream was that every health unit had a mental health unit attached to it. And I met with the health unit in Thibodeau and said, wouldn't it be a dream that every time someone came in for their physical needs, and oftentimes it's addiction, that we can just send them right next door to the mental health unit. And so that's what the parish is doing down that bayou, and it is amazing, the things that they're doing. I will say often, when we're trying to combat this epidemic, I think what all of us need to realize is, especially today, looking at, if you're on social media and looking at our nation, people are broken. You are broken. All of us are broken, and just in different ways. Everybody in here has been depressed. Everybody in here has struggled, and you struggle in your own ways. An addict, if they do not have mental health disorders that are diagnosed or undiagnosed, are usually sad and trying to escape, and they have no hope. And thankfully, sometimes they can find hope that gives them a reason to live. But they're not bad people. We're not bad people. We just are broken. And sometimes it's going to take leaders to help those individuals get the help they need. Sometimes it's incarceration, but sometimes it's helping our fellow man just trying to find their way. We are working on partnerships, communication, and working with our families, because families are where it's broken first. And so that is who we need to support. I want to let you know before I stop, one thing that we are working on. We are working on a nonprofit. It's called The Reservoir. It's going to open in the middle of our parish. It is a resource center. And what this is going to be, people call us all the time and say, I don't know where to call. My grandson is struggling with addiction and I don't know where to call. You guys have connections. You know who to call. They don't. And so the doctor is saying they will give resources out. This is going to be a place when you don't know where to go, you go. And it's not going to be tied in with my office. It's not going to be criminal. But when they go, there's going to be someone there to greet them, do a little mental health triage, and figure out what's the issue. We're going to make sure that they get to where they need to get. Is it mental health? Is it addiction? We're going to have support groups there, because guess what? We don't have support groups anymore. Guess what? We don't have mental health at our hospital in Thibodeau anymore. Guess what? We're talking about physical health. If we don't talk about mental health, I'm going to be up here, and well, if they keep me in here, 15 years and 20 years from now, we're going to still be talking about the same thing until our conversation shifts to mental health. And until we do that, we're going to have addiction, and we're going to be right here, because dealers work on vulnerability of our users. And so the Reservoir, look out for it, is going to be amazing. We have some amazing partners in our community who are willing to help us. So thank you. I'm looking forward to your questions.
This is all fantastic information, and you know, just again, our panel is doing so well. And so next we have Louisiana Representative Brian Fontenot to share with us from a legislative perspective.
Yes, so thanks for the opportunity to be here. I could say that when they first spoke to me and asked me to come, I probably had some reservations, but you know, when you get in the legislature, they look at your core values, they look at your experiences, and they dial you in tight to what do you think your best are, and how can you work to change the direction of the things that you're left with, the laws that were previously made. So I had the great honor that a young man to be hired by Sheriff Weber within the first year. He put me to work in narcotics. It brought me to a place in life where I saw people in their darkest moments, those that were white, black, males, females, wealthy, poor. It led me to lead the drug task force for the city of Thibodeau, and that continued on for over a decade. But at some point in my career, things around me didn't look right. Things were missing from my home. Things were missing from my grandparents' home. And then we realized that my brother was addicted to drugs. My oldest brother, he was a police officer as well. We ultimately incarcerated him. He would spend probably a total of 10 years of his life in prison, but not before we tried to help him. We went to the sheriff, went to the DA at the time, was Butch, and we asked him, could you please put him in drug court? We did. And while he was in drug court, he chose to sell drugs to an undercover agent in drug court. We put him in incarcerated, and we go back to the sheriff. And we said, Sheriff, can you put him in work release? And he did. He came out probably with more money than any prisoner in the state's history. He worked for Danos. He came out on a highly successful path. He had 2 children. He had a good job. Bought a home. And then he took a turn for the worse. He lost his job. He began to lose money. And he did what so many people do. He returned to exactly what he knew that would give him relief, and that was drugs. He went just the opposite direction. Here we are now, just 2 years ago, he loses his family, he's been arrested again, he loses his children, and then on May 1st of this year, he lost his life at just 41 years of age. So it puts me in a unique perspective when we get to the Capitol to look at the laws that the predecessors before me created and how do we change them. I can tell you that I grew up in a law enforcement career that was embedded in incarceration. The words rehabilitation were only said in the police academy because they told you that's what the correction system was built on. Over Sheriff Weber's career, he's been a reformer. But to understand where we are, I had to go back and look for nearly 2.5 decades to explain to you how the laws have changed and what has changed for the good and what has changed for the better. I would tell you that in my law enforcement career, I have never put my hands on, and I've made more than 1,000 illegal undercover drug purchases, and I never put my hand on heroin. Because up until the year 2001, distribution of heroin in the state of Louisiana was a mandatory life in prison. You couldn't really find many heroin dealers at that time. In 2001, the legislature came in and they changed the sentence from life in prison to 10 years. You could look back at the epidemic, you could look back at this drug problem, and you could trace it back to the penalties that drug dealers are faced with. In 2002, they came back and said even more. The Louisiana legislature said, well, if you've been in prison for at least 15 years for selling heroin, we're gonna go ahead and let you out now. In 2014 was exactly what Sheriff Weber mentioned to you. We gave immunity to those people who call 911 for help in drug emergencies. Since that time, here we are, 10 years later, we've made significant changes to that law. Most recently, the Supreme Court has rendered some decisions about medical, and the dissent coming out of the Supreme Court from McAllen and McCain is about what is truly a drug overdose. The sheriff's right. He came to me and we spoke about it, and I'm gonna tell you, I'm gonna go a little further detail. When we filed the bill, we said that you would be immune from criminal prosecution, not on a first offense, not on a second offense, and my bill said on a third offense. But I knew I couldn't make that lift, so I amended it to say like on a fourth offense, on a fifth offense. We couldn't get that out. Mental health professionals from across the country piled into the Louisiana State Capitol and said that bill would take people's lives. People would be scared to dial 911 in a drug overdose. We said you could only be put into drug court. You could only get rehabilitative services. You will never go to what we call prison for a possession on a drug overdose. We just couldn't make that lift. We still remain today where the police respond to your home and they see their child overdose with drugs in the home, and we pick that up with no recourse. The police save your life with Narcan and they leave. Only in Lafourche Parish do police come back to check on you. It's one of the only places where his opioid interdiction system goes back to try to find those people who are addicted to drugs and give them help. Here comes 2017. Governor John Bel Edwards is the governor, and you heard this term 100,000 times. Louisiana is the highest incarcerated state in the union. Some people would tell you maybe in the world, per capita. But I would tell you this, for 25 years running, Louisiana has been the murder capital of the world. And it has 3 of the highest murder rates in the country, right here in the Louisiana top 10. New Orleans and Shreveport and Baton Rouge. That probably should make you believe if the police are doing a good job, probably should be a lot of people in prison. But 2017's Justice Reinvestment decided it was going to let people out of jail. In the year 2016, there were 8,072 drug dealers incarcerated in the state of Louisiana. Post-JRI, we released 38% of the drug dealers back into society. We did more than that. In Justice Reinvestment, we convoluted the way people would be sentences. We left people like Ms. Russell and our judges struggling to make a determination what drug dealers would spend in jail. Sentenced them to 8 years, and they served 20%. We reduced the sentence from distribution of heroin from 10 years now to 5 years and said, even if you sell drugs in the state of Louisiana, you may not even go to jail. If you sell heroin, if you sell fentanyl, the judge has the right to suspend that sentence. So now drug dealers are selling drugs and no longer even serving prison sentences. We go a little further. Currently in the state of Louisiana, if you sell drugs to an individual and that individual dies, the second-degree murder statute says you can be charged with second-degree murder. that burden is nearly impossible to convict. And Ms. Russell can share with you after this those cases that she's tried here in Lafourche Parish. It ties the hands of the sheriff. People are dying at copious rates. So what does the legislature make an attempt to do? In 2022, we introduced a bill called Aggravated Distribution of a Controlled Dangerous Substance. It lessened the burden that the prosecution needed from specific intent to general intent, so we could take these people who sell drugs to poor people who are in the addicted state, need mental health issues, and incarcerate them. That failed. We couldn't get that over the finish line to get to the governor's desk. In that same year, in 2022, when that failed, Senator Womack from Central Louisiana moved the distribution of fentanyl into what we call the violent crime statute. And all that did was mandated those people who sell heroin, fentanyl, would serve 85% of their sentences. In 2022, John Bell did some other stuff. We increased the money for Narcan exponentially. When you look at the numbers that were given to you on several occasions, in the year 23, 107,543 deaths, but it was down the following year by 3%. What they didn't tell you is that the overdose rate continues to rise. So people are continuing overdosing at an alarming rate, but at a higher rate, we're saving their life by Narcan. Governor Edwards put funding so drug users could get litmus tests. They could test their drugs and determine if it had fentanyl in it before they consumed. It was in 2022 that the sheriff and I failed our attempt on the immunity clause. When you first glance at it, I was probably surprised. Here's the statistics he didn't give you. In that same year, he had 60-something drug overdoses. 20 of those drug overdoses were more than the same person more than one time. 5 of those were people they had saved more than 3 times. And one of those individuals that Sheriff Weber's agency saved their life was the 10th time that he had saved their life. If that doesn't cry out for somebody we must help, then nothing else really does. Governor Edwards, his term's up, and here comes Jeff Landry. He's got an initiative for crime. What are we going to do? Somewhere in this molecular structure, there's exactly what you know about science. There's protons and neutrons, and there are drug users and drug dealers. And when one of those goes away, neither one of them are in business. So our approach at that moment, when Governor Landry wins, we select 7 people to serve on a criminal justice task force to start revamping where we are. What do we look like? What are we going to do? I served on that task force, and right away, we raised the penalties for distribution of heroin, distribution of fentanyl for those people. We took away the judge's discretion that they could suspend the sentence. Now you must serve time. Because of the burden that the district attorney faces, we also added into the distribution statute that says, if you sell heroin or fentanyl and someone becomes ill, incapacitated, passed out, a drug overdose, they get the option to add 5 years to your sentence. So we're trying to ensure that people who sell these illicit drugs to poor people who are addicted serve time in prison. This was brought up when Governor Landry was the Attorney General. He got involved in the opioid suit. Today, we have, the original amount was $325 million came to the state of Louisiana. Much of that remains in coffers, and we distribute it out to parishes on a yearly basis. They kind of explain to you what we do here in Lafourche, but we were really in the minority. Drug courts in many parts of this state probably didn't exist. If you went to the Beauregards and the East Carrollton, there was no drug court. Either you was incarcerated or that was it. So we've expanded drug courts significantly under Governor Landry. We've increased money for mental health services to the tune of about $100 million. This young lady right here says something that I thought was pretty important. Maybe 15 years ago, my business partner came to me and said, I'd like to donate some property to Women's Restoration on Serenity Drive. I said, Mr. Sternfeld, I think that's a good idea. She said Christianity, she said Christ, her faith in Jesus. You won't walk in a classroom in Lafourche Parish anymore without seeing the words "In God We Trust." We've dialed our society so far away from Christian values that it's hampering our children. It's hampering my own two children. We've put in that legislation about Christianity. We corrected the 2017 Justice Reinvestment Catch and Release for drug dealers. At this point forward, all crimes, if you get sentenced in the state of Louisiana, shall serve 85% of your sentence, no matter what. From stealing a Snickers to selling fentanyl, you'll serve 85% now that Governor Landry has made that initiative. It's a tough balance for me. And for those people who've never been addicted to anything, sometimes it's hard to see. If I could go back and undo the things that my eyes have seen for people that I know today, who I go to church with today, and watched how addiction destroyed their lives. Good people, good wealthy people, Christians. How does the state do more? Where do we find the dollars? What's the tough balance? Is it incarceration? Is it rehabilitation? I gave you my own story. There came a point where only incarceration could take my brother and keep him sober. And he maybe it wasn't fentanyl, but he always drove to an addiction. And in the last hours of his life, he just faced turmoil. He was on his way to rehab. And he had an expired inspection sticker on his truck, and the police stopped him. He was driving under suspension, he didn't have insurance, and that was it. That was the end that he had to give up on his life just a few months ago. Over my career, though, what I've seen, and I hope that history repeats itself, we typically have decades of drugs. Probably goes back to 1969, August of 1969. Hundreds of thousands of people traveled to Bethel, New York for Woodstock. That drug of choice was something called lysergic acid diethylamide, which you know as LSD. Then the 80s come, and here comes cocaine. In the 90s, that's what Reggie grew up around, is crack cocaine. Here comes 2000. It's methylene deoxymethamphetamine, is what you know as ecstasy. Here comes crystal meth in 2010. And then about 15 is really when heroin and fentanyl come on the scene. So what I've learned is that drug dealers are street level entrepreneurs. They're entrepreneurs that deserve to be incarcerated. I've also learned this, that people who use drugs are victims. And when we as a government take an approach to find more money for rehabilitation, to help those that are users, and find more money to incarcerate those people who are dealers so they can no longer sell, we'll become a better society. That decade of drugs, hopefully for us, is about to change. Hopefully we are at the end. We are within that 10-year period now where drugs have typically changed and the type of drug and what people use as drugs. Unfortunately, when you look at that list, they become more potent, they become more addictive, they become more dangerous, but never until fentanyl has it ever become more deadly. What do we do? I had lunch today with Sheriff Saunier and Chief Terrio, who's in the back of the room. So Travis, what do you do? He says, I treat every overdose, everyone in the city of Houma, like an attempted murder. I gain access to their phones. What we do know when we listen and we track overdoses, the sheriff will tell you, he could go 2 weeks with 0. And then all of a sudden, there are a multitude of overdoses that are occurring. That means a dealer has brought bad drugs to us. Rest assured that drug users know that as well. So give credit when people like Chief Terrio are telling you he treats every single overdose. Every time you call for help, he's looking into it like a homicide. He's evaluating the phones. He's linking data. He's putting statistics together. He's figuring out what are the common denominators amongst all of these users and how do we find the person that's devastating our community. I just want to finish and say, look, the legislative work is certainly not easy. These talks are destructive because we get those people who sit in the Capitol and they want to put everybody away for life. And then you get those people, like this lady here, who have honest testimony that rehabilitation is real. Somewhere amongst all of that testimony, there's only 105 of us that cast a vote. And whatever I vote on and the governor signs, the sheriff and the DA are left with. The branches of government forward down this legislation in hope that it's correct. Know that myself, my colleagues, and certainly Governor Landry are extremely laser focused on this issue. I can't tell you what I think it is on a scale of 1 to a million, because it's pretty high. But never a loss of life, ever, is good. And when you lose good, honest people to mental health addictions, just drive over to my mom's house and you will see a woman that thinks she did nothing, and she did all she could to walk in my brother's bedroom and find him on the floor deceased. So know that we're working for you, we're looking for alternative solutions, but this is a battle that is going to be raged on. President Clinton said he was in the war on drugs, 1992. Here we are, entrenched in the greatest battle of our life. Thank you.
Yeah, we're hearing very powerful information tonight, and I want to share something with you that you are very powerful. When you contact not only your legislator, but all the legislators in the state on issues that are important to you, it does make a difference. When you call, when you write a letter, when you send a text, it makes a difference. A lot of times we just look at ourselves and we think, well, I'm just one person. What difference can I make? But when one and they get those calls, they start paying attention to what you're saying. And then when good legislation is given, then they will support it. They will listen to your voice because you put them there. So I just want to remind you about that. Also, we have a few questions. So, Ms. Eckel, we'll start with you. It says, why did you get started with drugs in the first place, and how would one be able to avoid starting?
Okay, so I actually, I grew up in a really good home. A lot of people, usually they have a background of abuse, different things like that, that forced them to turn to drugs. But my upbringing was really well. I grew up going to church, but there was always something missing. I ended up right out of high school thinking that I was going to get married and have this picture-perfect life. And whenever that fell apart and it didn't look like the life that my parents displayed for me, I fell apart and began partying and got introduced to the wrong people and got introduced to drugs. So that's really how it all began. It was a downward spiral from there. What started out as drinking turned into pain pills, which then turned into coke, which turned into meth. Everything that I said that I would absolutely never do, I ended up becoming that person. What was the other part of the question?
How would one be able to avoid starting that spiral?
That's pretty difficult to answer, yeah.
I didn't write them, I'm just.
Right, I mean, I'm not really sure, I'm not really sure how to answer that. I do know that, that people are searching, they're searching for something. There is a God-sized hole in every single person, and everybody wants, you know, they're looking for a substance that is going to make them feel good, feel loved, not feel alone, and the only thing that can actually fill that void is Jesus. So.
Very good, thank you so much. This is for Representative Fontenot, and again, this, I didn't, you know, I don't know how you answer these questions, but, you know, we see these smoke shops and all of these things throughout our community that are pushing marijuana, synthetic marijuana, other drugs, you know, and it's like you were sharing earlier, it seems like the entrepreneurship among the dealers is one step ahead of everybody else. Is there something we can do proactively to see these businesses lose money instead of making so much? I don't know how to say that.
Yeah, so let's start with the obvious, and people always have the question as a legislator. Look, I get the disadvantage that I always have to tell you my opinion because I have to go up there and cast my vote. So let's start with the legalization of marijuana. Where we are in the state of Louisiana, what's it look like and where we're going? I would say that I'm now in my 5th year, and I probably don't see any notion under a Republican governor that marijuana will become legal. I remain opposed to the legalization of recreational marijuana. I have supported on numerous occasions the expansion of medical marijuana. I do believe that there is a place for marijuana in the medical community. So let's go to those smoke shops, because up until really last year, those people at the time could only sell CBD. But the federal government changed its what they call Farm Bill, and they made hemp legal. It was sold to the legislature that it would be and the individual tests positive for THC, they are guilty of DWI, and if that DWI resulted in death, they could be guilty of vehicular homicide. Now people are buying a legal substance in the state that's causing them to fail drug tests. It's causing them to become criminalistic in their approach if they get arrested for a potential DWI. So in the last session, there was a huge fight that ensued to the last minutes of the legislative session. I wanted to stop the sale of THC, and so did a lot of other people. Those businesses came up and fought and said, hey, we've got all these investments, you can't put us out of business. But I want you to know they had zero regulation. Today, you cannot go and open up a place that's going to sell alcohol next to a school. But you can go open up a smoke shop across the street from the school and solicit it to children. You have to sell and tell you what percentage of alcohol is in the alcohol, but you could go buy THC and it didn't matter. We limited the milligrams. How many milligrams? How it's going to be packed? Take it away from children, put it behind the counter, limit who could sell it. You still sell it at Rouse's. So I'm gonna just encompass that. We made an attempt, and I'll tell you this, that one of my bills, I only get 5 bills next year, but one of my bills will be, they have currently, those shops pay 0 tax, unlike the tobacco tax, alcohol tax. One of the bills I have will be to bring the same tax that medical marijuana has to those vape shops, smoke shops. My intention would be to take the revenue from that and dedicate it to things like rehabilitative services and enforcement of those crimes. So that is where we are with smoke shops, THC, CBD. Hope that answers your question.
Thank you. This is for Dr. Caleb. Is Suboxone addictive?
Suboxone is a combination drug that has a anti-abuse medication with it. So while it technically, yes, it can be addictive, it kind of prevents itself in overdosing, if that makes sense to you. So it can be addictive, but it's, if used for the right purpose, it's to help, transition folks away from the illicit substances and onto recovery.
Thank you. Now, this is for whoever wants to reach out and grab it. Do you think fatherless homes affect the drug epidemic? Do you think fatherless homes affect the drug epidemic?
And I think the sheriff's probably best suited to answer this question, but there is a number. And when you go to prison, you ask these questions. And the sheriff may know that exact number, but the number is fairly high. And two statistics that are blaring inside of our state correctional facilities, and there are these two. Were raised in a home without a father? Yes. And do you have a GED or a high school diploma? And the answer is no. When you look at those two statistics, you got to understand it's probably the leading cause of driving people to criminal activity. No guidance and no education, for which, give Sheriff Weber credit, that's his initiative. When people go to his facility, he works previously to give them an education so when they get out, they can be productive members of society.
Thank you. Next, are there any statistics on recovery for Christ-based rehabs versus non-Christian recovery programs?
That is very difficult data to find, but I will tell you, working in this field for as long as I have worked, we have seen a exponentially higher success rate in faith-based, Christ-centered, faith-based. Now, try to find that online, try to find the stats, try to find the data. It's tough to find that data, but having worked in it and been around it, you could exponentially see it go up when it's faith-based, Christ-based. That being said, in the field that we're in, we always meet them where they are, just like our women's restoration and APOR. You meet them where they are, and they're coming in where they're at, and then you're presenting Christ to them, you're presenting faith-based to them, even though that might not be exactly where that individual is, but you do present that to them, and hopefully they'll be drawn to that as well. But yes, to answer your question, we do see a higher success rate in the faith-based.
Thank you. For DA Russell, can you please talk more about the reservoir? Is this a United Way program?
No, it's not. So the reservoir came about, I think you and I talked about this a couple years ago. I just kept saying that I had this dream about this resource center that would have pretty much everything a family would need. Like if they would go in, almost like a mall, and they would say, I need food, or I need clothing, or I don't know how to fill out Medicare forms, I don't know. It would have everything in this place. So we visited the one in Baton Rouge. So Baton Rouge, in the middle of downtown Baton Rouge, there was an old school that was donated, and I forgot the name of the resource center, but it's amazing. So they tell the story of a grandfather who walked in with his two grandchildren and says, I was just given custody of these children. I have no idea what to do next. They brought him in, and they had a food pantry there, so they made sure he needed that, and they gave the kids some things, some toys, and then they talked about mental health because there was a counselor on site, and then they almost had like a caseworker, someone there to make sure that we kind of followed up and they got what they needed. Now there's no way that we could probably have beds there and do inpatient, but we certainly would be able to have the contacts to get people where they needed to go. So I was sitting in a meeting, and I mentioned this dream I had, and there was an individual, and I'm not even going to say names, Joe. I'm talking to a woman, and she was like, oh my gosh, I thought the same thing, I would love that. So we've been meeting, we're forming the LLC. I think there's a meeting on Monday to get the documents signed. We're meeting with nonprofits to beg for money. And then, because someone asked me, I met with a family down the bayou who has a lot of money, and they asked me, well, how are you paying for this? I'm like, well, I don't know, I have ideas. I have no clue how we're paying for it. So we're bringing a lot of people to the table. It's gonna have to be buy-in from the community. If the state cannot afford to give us programs, and if the state, which I understand, does not have the money to give us mental health counseling, then it's up to the community to do it. So we have to invest in our own community. It sounds selfish, but we have to do it. And I firmly believe that we have the building, by the way, it was given to us. So I firmly believe that once it starts, we're all going to give our time and our resources to this amazing place to give back to the people who need it most, which is the people in our community. So, United Way's not there yet, but I'm sure I'll call them.
Keep our fingers crossed. Right, excellent. Next, are the school systems accessing Narcan for their students?
Yeah, every school has a resource officer, so all the resource officers are equipped with Narcan. However, we are getting calls, myself and Dominic both are getting calls from the school, various school boards that are wanting to get into their schools as well.
Yes. And is the use of Narcan actually reducing the drug problem, or is it just covering up the usage?
Well, we can see by the numbers that the use is going up. The use is going up. The addiction is real. We're in actually the fourth wave of this epidemic that we're in. The first wave started in the 90s to 2000s, where we saw overprescribing of the opioids. The second wave would have been because they developed such an addiction, they weren't able to get the amount of prescription opioids. They went to heroin because it fits the same receptor sites. Third, it would be the fentanyl came on the scene. Now we have other substances in the fourth wave that we're entering into, is other substances are being laced with fentanyl. So this problem is growing rapidly. I would love to give you better news than that and tell you that the Narcan is really helping out these individuals. What the Narcan is doing exactly what it's supposed to do, is keeping them alive.
Saving lives.
Mm-hmm.
Yes.
It's keeping them alive.
All right. I've often heard prosecution of drug dealers is a major contributor to the continuing drug problem. Speak to the statistics in local parish and prosecution rates and adequate sentencing, helping to prevent them from being back in the drug business as soon as possible.
I guess the DA can talk to that.
Sure. I think Representative Fontenot did a great job of covering what it looked like for us a couple of years ago. I mean, we would sentence someone to 10 years and they were out in 18 months. I mean, that's just, because it's a nonviolent crime. If there was no victim and there's no violence, then they would not really serve any time. And so for us, it was very frustrating because you put so much time in, and if we're offering jail and we offer 10 years, we kind of want 10 years. And so with this new 85%, we haven't seen if it's going to make a difference yet. We haven't seen any of that yet. I mean, the laws have just changed. Statistically, you know, we probably had, I was looking at the numbers before, we probably had about 450 felony drug cases that were resolved in 2023, which is a lot. Most of them, we can't take them to trial because remember we have 6 jury trials and we tried a bunch of murders, we tried a bunch of rapes. So our children come first, obviously, to make sure that we get them through a trial as quick as we can. And then we try to get to the other ones. The cases that we are getting to now, our judges are giving big numbers when we're telling them that we're talking about dealers. We really are separating out the difference between our users and our dealers. Representative Fontenot had mentioned the sheriff's office had worked a couple of overdose deaths as second-degree murders. And so when we were able on those cases, it's hard to prove it. It's hard to prove that that very substance that individual gave is the cause of death. So if fentanyl was given, but in their blood was a lot of other substances, we need someone to say, but it was fentanyl was the one that killed them. But we had a couple cases they gave us that were pretty great. I mean, as far as the proof purposes, we were pretty on point and we thought we could do it. So we filed second degree. We were really struggling to pick a jury. The jury with pool was basically telling us it was hard for them when users are users and there's accountability for your actions. They were struggling to get to a second degree. So we got manslaughters on 3 of the cases that were second degree, and they got 35 years, I think, on one, and maybe one was 30, one was 25. So what we kind of learned from that is if we have a second degree on a distribution overdose deaths, our jury, our people are really looking at maybe going with manslaughters. That doesn't mean I'm not going to continue to file second degree murder if we're really showing dealers are killing users. Again, we're going to continue to do what we're doing. I'm just telling you in the cases that we filed last year, that's what we're looking at is manslaughters.
Thank you. Thank you. Now, I have one last question, and I think y'all have all alluded to the answer of this already, but still is here. What is anyone doing to stop the supply of drugs into our area? Anybody?
Well, I don't want to go back and repeat all the numbers, but the numbers are pretty significant. But one of the things that we have to deal with now, which we didn't deal with 20, 30 years ago, is availability. I mean, you can order this stuff from anywhere and have it brought to your house in the mail. You know, back in the days of crack cocaine, you had to go drive down this neighborhood and wait for the guy on the corner to come and do the hand-to-hand. Those were easy to catch. And that was just observation. It ain't that way no more. You can make it yourself. You can go on the internet, get the recipe for shake and bake methamphetamine, and you got your own drugs. You can get a script from a doctor, and you got your own drugs. You can order it on the internet, you got your own drugs. So, you know, eliminating the supply, we continue to chip away at it, but really the demand is going to take the supply out of business if we ever can get the demand piece controlled.
Yes.
Thank you. Let's give them a hand for tonight.